All right. In fairness, we didn't know the Tina Turner one, but Royce knew right off the bat, straight up from Paula Abdul. So Captain Stevens played that really well. Yeah. So Captain Royce Stevens has had over 33 years of law enforcement. 25 of those years have been spent here at the city of Stillwater, serving our community. His current role is captain. He's oversees our operations bureau commander, or that's his role. He oversees our patrol units, animal welfare, and all of our criminal investigations. His experience, he first was he was a previous Oklahoma State University police officer before joining the city. He was an active duty military police officer for the U.S. Army, and he's done undercover narcotics assignments and assignments. He was our canine handler, is that what we say? Canine cop. So, let's please welcome Captain Royce Stevens.
See if I can get that turned on. There we go. So, when Councilor Clark asked me to speak here today, I did not realize that literally every one of my bosses would be here. And my ex-boss would be here too. Anyway, I appreciate the introduction, and very sorry I didn't know Tina Turner. I feel like a failure. Actually, I was 20-something years ago, I was on Who Wants to Be a Millionaire, and Norm McNichol was one of my lifelines. I just asked him to be nice because I knew he wouldn't know anything if I called him, but I did ask him. So as Brady said, I've been a police officer for March will be 34 years. So I've been in law enforcement one stripe or another for 34 years, and had a lot of assignments, everything from federal game warden to undercover narcotics to community policing coordinator, just lots of things. And I say that to tell you that I've contacted a lot of people, tens of thousands of people in my law enforcement career, and that, people don't call the police department to tell us they're having a great day. That's not why they call. They call because they have an issue. There's some crisis going on, whatever it is. And when you contact these people, here's what I find. Whether you're talking to a doctor or a drug dealer or a principal or a prostitute, they are all the same. They're all people having an issue. And they're hoping we can help them solve it. And so I'm going to talk to you today about homelessness in Stillwater from the police department's perspective and what it looks like for us and some of the impacts to our community in that. Now, I'm going to give a caveat here. Everything I'm going to talk about today is Stillwater. Our homeless situation is different than Portland's. It's different than Perry, Oklahoma's. They've got a bus route running through town. Their Greyhound bus comes through town. They are dealing with a different demographic of homeless than we are here in Stillwater. And I've spent really the last 4 years really delving into this issue and working with some police officers and trying to figure out what actually our problem is and what it looks like for us. And so let me start out with some definitions. Okay, so if you listen to people talk about homelessness, they're going to talk about housing insecure, unhoused, homeless. It's all the same thing, and people are trying to use the right term. So I actually have spoken to some of our population in Stillwater, and are you homeless? Are you unhoused? And I'm like, well, that tent is my house. I don't have a home though. Or they're like, no, that's my home. I need a house, or whatever it is. My favorite is a guy who told me I'm neither. I'm an urban outdoorsman, and so that's what he chose. And so what I'm talking about with those people, those are people that are living outdoors. They're in a tent, whatever. I'm not talking about people that are at the Mission of Hope. The Mission of Hope is not a temporary shelter like people think about. I was on the board for quite a while at Mission of Hope, and it's that's a program that you enter into where they take you through temporary housing and get you stabilized and get you an ID and try to help you get a job and give you transportation to and from and try to move you into transitional housing. That's a program, right? Wings of Hope, same kind of deal. I'm talking about people living out in tents. I'm not talking about couch surfers. We all know what a couch surfer is. They may not have a permanent mailing address, but they've got somewhere to go to at night. You may have seen Stillwater Public Schools said we have 200 homeless children in our school district. They aren't living outside. Those are couch surfers. I can tell you this for a fact. We have never encountered someone under the age of 18 years old in the city of Stillwater living outside. In 4 years that I've been looking into this, we haven't found that person. So they may exist. I'm not saying they don't exist. I'm saying we haven't found them, and we look hard for them. So those are the kind of definitions I want to talk about today. So if I say homeless or I say unhoused or whatever it is, I'm talking about the same thing. So I want to talk about some actual numbers. I'm going to give you some numbers today, actual numbers of homeless and how we come to that. What we found to be the causes for our population here in Stillwater, the impacts on our community, and maybe some solutions that we're working on at the PD. So I always ask this. Somebody go ahead, tell me how many people, the people that are living outdoors in tents, how many do we have inside the city of Stillwater? 125. 200. Perfect. We'll go with those. I usually get numbers, and lots of times I get numbers a lot higher than that. But I'm going to give you a number here. This number is good as of last Thursday. 23. How do we get that number? Well, twice a year we do what's called a point-in-time count. We have nonprofits that come in from out of town. They pair up with one of my police officers, who I'll talk to you about a little bit later, our crisis intervention officer. And they go out under the bridges, down the railroad tracks, into the woods, behind wherever. Everywhere in the city of Stillwater, beating the bushes, going through tents, talking to people, and they go through the town. They take counts of those. Now, last Thursday was very cold, right? So they went to the mission and they said, how many people are in here on emergency shelter? Well, there were 15, 6 women and 9 men. And so those people, if it hadn't been for the cold, they would have been outside. They're counted in that 23. So that number has remained consistent between 23. Actually, 23 is the lowest count we've had in 4 years. The highest has been 28. And so do we think that count's accurate? Well, I think it is on those days. We go out, my crisis intervention officer, he goes out and he does a monthly sweep through town. Throughout the month, he will go through every known camp that we have in town, and he knows every one of these people. And he'll go out there and he'll find out where they're at and how they're doing. He'll go out and also do weekly check-ins. So we have the twice a year, we have a monthly camp check. He does weekly check-ins, and then we have daily calls for service, dealing with, and when I say daily, I mean dozens of calls a day, dealing with these same 23 people. If you drive down the road and you see somebody sleeping on a sidewalk, do you think you're the only one who calls in and he doesn't move and you're worried about him? No, there's 40 other people that called in about him too. So we get several calls for service on them. So in doing that, our officers get to know these people really well. We keep track of them and talk to them, try to work with them. But we feel very confident in those numbers, and people are usually really surprised because I've gotten up to 2,000 as an answer before. So 23 is a good number. So just keep that in mind as I go through this. So what causes these people in the city of Stillwater to be homeless? So the quick answer that I get from people, well, it's the economy. They lost their home or whatever it is. That person doesn't exist in the city of Stillwater, living out on the street. I haven't found them yet. People that have, the single mother who couldn't pay her rent, who lost her apartment and whatever, there's programs for them, and they are in them. And they are being cared for, they're being housed, they're being moved through some type of program somewhere. Our officers have yet to encounter someone who is unhoused in the city of Stillwater because they couldn't pay their rent. That person just doesn't exist here. Just like the juveniles, we have yet to find them. And we look hard daily, weekly, monthly. So the economy, I'm not saying it doesn't have an impact and it doesn't change things, it does, but that's not the real cause of homelessness. So I'm going to talk about 2 things that we find that in common with most of these people that we contact. And they're overlapping quite a bit, not 100%, but they overlap quite a bit. It's mental health issues and addiction. So how do we know that? Well, we go out and we talk to them. We know what's going on. We work very, very closely with Grand Mental Health in these things. And let me just put it to you this way. So a couple of years ago, unfortunately, you probably saw in the news, we had a homicide of a homeless person under a bridge over on Perkins Road. The suspect was also a homeless person. And in that, I'll be really transparent with you. My assumption at that time was our increase in do you think homelessness has increased, or the visibility of homelessness has increased in Stillwater over the past 3-4 years? You see a lot? Okay, me too. My assumption was those people were coming from Grand Mental Health, because 5 years ago, Grand Mental Health also showed up in our community. And I thought, well, people are coming here for services, and they're leaving Grand Mental Health and they're staying here, and they don't have any place to go, and they're sleeping under our bridges. And a lot of people thought that and still think that. That is usually the answer that I get when I say, what causes homelessness here? They say, well, they're here because of Grand Mental. That is not true. So here's how I know it's not true. When we had that homicide, the detective leading that, I said, I want you to find out who these people are, because he had to go out and interview every homeless person he could find, right? Who are these people? Why are they in Stillwater? And why are they homeless? Well, this is what he found. He interviewed 22 people during that investigation, and about 18, 19 of those folks were urban outdoorsmen, right? They're living outside. And what he found was that 100% of those people had a Stillwater nexus. They were here because they grew up here. They moved here because their brother was here, and they were living with their brother at some point, or whatever. Their girlfriend was here, and they lived with their girlfriend. That ended, or whatever. But they had a Stillwater nexus. They had a reason to be here, and not one of their reasons included Grand Mental Health. The other thing that he found was that 100% of the people that he interviewed were addicted to opiates. 100% of them were addicted to opiates. And so that kind of started us thinking, well, what's that? And let me back that up a little bit with Grand Mental Health. Grand Mental Health, so if you aren't aware, the regional director for the crisis arm of Grand Mental Health is Tom Comstock, retired Stillwater police officer, and my partner in K-9 working for 15 years. I've known Tom forever, and so we have a very close working relationship. And he'll open his books anytime and let me look at it and see where people are coming from and where they're taking them to. And they have a policy that if someone shows up there, if they're brought there, when they're released, they've got 3 white Durangos sitting outside, and they get loaded up and taken back to whatever address they came from. Wherever that was. Doesn't matter if it was Miami, Oklahoma. They're taking them back there. And they do that. Now, I will say there was a short period of time when Grand Mental Health bought 12 and 12, the rehab center in Tulsa. They bought that out last year, about 18 months ago, I guess it was. And they were redoing their facilities in Tulsa, and they didn't have any place to do assessments. And so everybody in the state of Oklahoma that was going to go for rehab, they came to Stillwater, Oklahoma for an assessment. And they were here between 12 and 48 hours. Well, the facility in Stillwater here is a no-smoking facility. So you have someone that's trying to go to rehab. If you think they don't smoke, you're wrong. I guarantee you they want a cigarette really bad, and they wouldn't let them smoke there. They had to go outside and whatever. It was just too restrictive for them, and they would leave. They had probably about a dozen folks do that over a 3 or 4 month period. We found them all. We took them to where they wanted, because they wouldn't go back to Grand Mental. They were mad at them. So we took them where they came from. So there was a short time frame where we did have a little bit of an influx, but that is a fallacy. And I'm sure plenty of you in this room have heard that or thought that, because I did too, and it's just not the case. But addiction. Okay, well, people have been addicted to drugs forever. How come we see them out on the streets now? What does that have to do with it now? Because everybody in here agreed just a minute ago that it's increased, that the visible homeless have increased. Well, okay, so we have a drug unit at City of Stillwater. I used to head it. I was part of it for a long time. I've been part of our drug task force, and I headed our special projects unit in the police department. And 4 years ago, and I wanted to make sure I had up-to-date information. I just had a big long talk with the head of that unit, and he gave me some stats. So 4 years ago, 81% of their cases involve methamphetamine trafficking. Let me give you a little education on methamphetamine. It's horrible, horrendous drug, does terrible things to people, but most methamphetamine addicts can hold a job, right? Well, so methamphetamine isn't cooked in labs anymore in Oklahoma. It's not like that. Methamphetamine comes from the Sinaloan drug cartel. 4 years ago, the Sinaloan drug cartel found out it was much easier to get liquid across the border for the past, for basically from 2015 to 2020. It was easier to get liquid across the border and take it to Dallas and powder it out into methamphetamine and distribute it across the country. And so the Sinaloan drug cartel from Sinaloa, Mexico, was based in Dallas, Texas for several years. Well, it's expensive. Methamphetamine, y'all seen meth labs, right, on TV, and everybody's watched Breaking Bad or whatever it is, and you've seen what that takes and what that involves, a lot of chemistry, a lot of danger. It's expensive to produce in a lab, in great quantities for them, relatively expensive. But all of a sudden, in 2020, what they realized wasn't expensive was the shipping containers full of powdered fentanyl that they could bring from China into Mexico and press it into pills by the billions for pennies. And when I say pennies, I mean literally pennies. And then all of a sudden they found in 2021, the border's completely open. We can take those pills across the border all day long, every day. And they did. And so methamphetamine became very hard to find, but fentanyl became extremely cheap. What's called a blue, it's a pill, which is a dose. For quite a while, you'd go to Oklahoma City, you could buy that for $1. What used to be $20 of methamphetamine was now $1 in fentanyl. And so the cartels just started bringing fentanyl up. And they use prison gangs here in Oklahoma based out of McAllister Prison to distribute those, and mainly out of Oklahoma City. That's where 90% of our fentanyl comes from, is Oklahoma City. And so all of a sudden we had an influx of fentanyl. As of last month, remember that number, 81% was methamphetamine 4 years ago? As of last month, 84% of our cases now are fentanyl cases. Here's a clue. Fentanyl addicts, opiate addicts, can't hold a job. You can go out and talk to them and they're extremely honest. They will talk to you all day. They will tell you they are an addict. Actually, they call themselves junkies. I'm a junkie. That's what they'll say to you. And if I don't get my fix, I get sick. So I told my guys, I said, well, tell me what their daily life's like. Talk to them, because they deal with these people constantly. They get up in the morning, they have to get their medicine. How do they get it? It's going to be about $10 for them here in Stillwater. How do they get it? They have to go steal for it. They're not stealing food, because everybody in Stillwater is really nice and they give them all the food they want to eat. Am I right? Am I right, Rachel? They can get all the food. That's right. Rachel will give them all the food they want. So they're not stealing food, but they will go steal something from Walmart, from Atwoods, from Academy, from Lowe's, and they'll take that and trade it. We actually have dealers in town that will put in orders with them. Hey, I want this, and they'll go steal it to come and trade it for their dose. Most of our addicts in town have to do that 3 times a day. 3 times a day they have to go steal something and then trade it. Now that's our male addicts. Our female addicts will tell you that they trade sex for fentanyl all day, every day. That's what they do. And so the reason that they're having to go and steal these things from Lowe's and Walmart and whatever is because, you remember I told you, these are people that had a nexus here in town. They were living with their brother or their girlfriend or whatever. Well, they stole everything in that house, got kicked out. They went to somebody else's house and they stole everything in that house. And finally they used up their entire support system and ran out of people to move in with. Every one of our homeless that's fentanyl addicted out there that we've talked to, they have a very, very similar story. They've been kicked out of every house that they've lived in because they stole everything there, and they'll be extremely honest with you about it. They will tell you what they stole. And they're outdoors. They have nobody else to live with, so they're living outdoors, and they have to get up every day and go steal to get their fentanyl, because if they don't, they get sick, and they do get sick. They get very, very sick. If if you're not aware of what I'm talking about, I don't have time to go into it, but look up opiate addiction and see what a heroin addiction looks like, or something like that. They do. They get very sick. So that's what the life of a lot, and when I say a lot, the majority of our homeless in Stillwater is about. It's about fentanyl. Now, a large number of them have an overlapping mental illness too. And so we get to deal with them a lot through Grand Lakes. We get to deal with them a lot through them going into crisis and a police officer having to be called because they're in crisis somewhere. Now, I will not say that 100% of our current homeless are opiate addicts. We have some out there. We have a couple that I can think of that have a true, extreme, demonstrable mental illness, but they're not a threat to themselves, and they're not a threat to someone else, usually. And therefore, we have nothing we can do with them. Who thinks, well, how come those people don't go live in a mental hospital? How come we can't put them in a mental hospital? That's exactly right. Thank you, counselor. There's no such thing as a mental hospital in the state of Oklahoma or anywhere really anymore. They've all been moved. What do y'all think the longest inpatient stay for mental health is in the state of Oklahoma? There's one place that you can have 10 days. There's one hospital left that has a 10-day inpatient stay in the state of Oklahoma. Usually it's 48 hours, 72 hours, something like that to get them stabilized. That's it. Where do they go when they get out? Right back out to the street. That's where they're going. So those are our causes of mental illness. What kind of impacts does it have to our city? Anybody try to use skate park at Strickland Park last year? Lots of homeless there. Now, there's not right now, and I'll explain why in a minute, but they live in our parks, they use our facilities, they live in the bathrooms at our parks, they're living on our sidewalks, things like that, or they're moving into dilapidated buildings, whatever, moving in on those, and we try to handle that through code enforcement or whatnot. But it has an effect. It has a huge effect on businesses. If somebody's sleeping on a sidewalk in front of a door to a business, it's very daunting for mom and kids to walk up there and step over them to get into a business, or even to pass by them on a sidewalk and get in a business. Do you think people are scared of folks like that? Do you think that? Sure. Do you think they have a reason to be? Yeah, maybe. That's a good answer. Maybe. Yeah. Because are some of them violent? Yeah, they have been. But I told you how they finance their drug habit. It has a unbelievable. If you talk to loss prevention at Walmart, they will give you a staggering number of what they believe they lose to homeless theft at their 3 stores in town here. Staggering number. I don't think it's right, so I'm not even gonna spit it out. But those tents that you see them in, those tents cost $100 a piece. They're not buying those, right? They're going to Walmart and Academy and stealing those. The impact in retail theft is very large. The cleanliness issue that it leaves in our parks and our sidewalks and stuff is an issue for our city crews and code enforcement and whatnot. But I was like, well, how much crime are they committing? Because being homeless is not a crime. But how much crime are they actually committing? So let's see, what is this, January? So 22 months ago, we switched over to a new computer system at the police department. And so 2 months ago, I said, hey, because it's very easy to search. I said, hey, go back 20 months, because that's when we started that new system. I want to go back 20 months, and I want to find out how many cases we worked where the suspect was a homeless person. Now remember, I said there's 23 right now, so let's say 25 on an average. In 20 months, there were 516 police reports filed where the suspect was listed as homeless. Now, I'm not saying that someone who lived at the mission or was couch surfing didn't list themselves as homeless if they were arrested or contacted by the police. So I'm not saying that those 25 people account for 100% of that. But that's a large number. 516 crimes. What were they? Well, I already told you one of them was homicide. What's that? Stealing, that's right. Petty theft, grand larceny, a lot of trespassing, but also a lot of assault and battery with a dangerous weapon, assault and battery on a police officer, and several sex-related crimes committed by these individuals. So how many of them were victims? We had 40 police reports where a homeless was listed as the victim. You know, they listed themselves as homeless. 39 of those overlapped, and the suspect was also homeless. So we had one case in 20 months that a homeless person was listed as a victim and the suspect was not homeless. So 515 cases, the suspect and victim, you know, there was an overlap there of homelessness. What does that mean? Well, 500, I mean, just think of that in terms of a police department responding to that, writing all those cases, responding to every time somebody's sleeping on the sidewalk and then somebody sitting at a red light doesn't see them move while we're there. Believe me, they call us every single time. I sit through a red light and they never moved. Yeah, they're asleep. You know, you know, we go wake them up. Hey, you okay today, Bob? Yeah, I'm all right. Okay, thanks. But it, you know, it has a huge impact on manpower. It has a huge impact on businesses here. You know, we have a lot of businesses here that are owned by folks out of town, you know, concerns out of town. A lot of our strip malls and things like that are owned by people that don't live in Stillwater. And I get calls from them routinely going, there's homeless all over my shopping center and I want them gone. And, well, okay, there's a process to go through. Now, for quite a while, there was a Supreme Court case that was out there that would not allow us to remove people from public parks. It's kind of a weird deal. We have an ordinance that says you cannot camp overnight in a public park. There are ordinances that says you can't sleep on a sidewalk, that it has to be ADA accessible, things like that, right? But Supreme Court, well, not Supreme Court, I'm sorry, there was a appellate court ruling out of the Ninth Circuit that said being homeless isn't a crime. Yeah, we get that. So you can't move them out of a park. So what that literally meant is if you're camping in the park with your son, because you want to go camp at Boomer, right? And I walk up to you and I say, hey, what are you doing? Me and my son just want to camp out here tonight at the deal. Well, here's your $200 ticket. Get out of here. What are you doing? You can't camp out here in the park. And you're right next to another tent. What are you doing? I'm homeless. Well, you want to go to the mission? Nah, I don't want to go to the mission. Okay, have a good night. Yeah, and leave you there. Well, Supreme Court actually heard that case, and it went up to Supreme Court, and they heard the case, and they said, no, that's wrong. You can't do that. If you have an ordinance that says you can't camp in the park, you don't get special permission because you're homeless. I mean, so, you know, do we need to clean out our parks? Do we need to make our parks usable? I imagine Christy Driscoll would say yes, because she's in charge of parks. She would say, yes, we want our parks to be usable by people. So what do we got to do? What can we do? I mean, there's lots of things going on in town. I'm sure if you've looked on Facebook and social media, you see all kinds of groups out there wanting to do something for the homeless, all these things. Well-intentioned people. We have Stillwater Cares that does a ton of work. They're looking at doing work on a big scale with not just urban outdoorsmen. I mean, with everybody that's experiencing some type of housing instability. We have great things like Our Daily Bread, and we have the Mission of Hope, and we have all these other things. But I just off the top of my head, named off all those people, and they're all doing their own thing, right? We have to think about what do we do to bring that together and be able to do something together, because what makes this person homeless or unhoused is not the same thing that's going to make this person unhoused. You know, this one has some type of mental health coupled with a substance addiction and whatever it is. This one over here is a veteran with mental health issues or whatever. Well, the resources are different for those two people. What's available to them is different. Do we have homeless veterans in Stillwater? Yes. Do you think that if there's a veteran that's homeless, do you think that there's an organization out there that will put them in a place to live? Go like this. There are several of them. They're everywhere. They're looking for homeless veterans to put up. Let me let you in on a secret. There are several of these people. I can go out there today and I can say, here's your house. Go live in it. And they will not do it. Am I right, Rachel? There are people that absolutely say, no, I will not live in a house. I won't do it. They're where they're at and they want to be there. And they will not accept your help. I found that very hard to believe until we had a local hotel give us a bunch of vouchers, and we're out there trying to pull people out from under bridges going, hey, man, it's freezing. Go to the hotel. I ain't going to the hotel. I ain't sleeping in a house. I ain't sleeping indoors. They would not do it. I mean, not just one, numerous ones would not do it. It shocked me. Couldn't believe it. Just because their thought process is going to be different than ours. Remember what I said at the very beginning. These are people with issues, right? And so we're trying to figure out how to solve that issue the best we can. So a couple things we've done at the police department. One of the big things we did, so I mentioned earlier, I had a crisis intervention officer. So Vice Mayor Pat Darlington about 4 years ago came to us and said, hey, I watched this documentary on TV. I seen this thing on TV. We're like, oh, great. And so crisis intervention. Of course, I'd heard about it at police trainings and stuff like that, but they were modeled in huge towns, you know. That particular documentary is in San Antonio, Texas. You know, it's a department of 2,600 police officers, and you know they've got these crisis intervention teams that go out. But we said, you know what? We're going to take it out, and believe me, we do not have manpower. we are always strapped for manpower. We said we're going to take an officer and donate to that, and OSU PD said we're going to do the same. And they gave us an officer, and we teamed them up in what's CIT, Crisis Intervention Team. And we put on, we said, let's see what this looks like in Stillwater. And we put them out about 4 years ago, and they went out and they started doing it and going out. And their job was basically to stop people from going into crisis. Find people before they got into crisis, because the last thing a police officer wants to do is go to a call where someone is in a mental health crisis. We're not equipped. You know what's on my belt? There's a gun and some handcuffs and all kinds of tools and things, and none of them are fun for people. And we don't want to show up to somebody who's having a true mental health crisis and have to use these tools. And so we had to train officers. Okay, you got to go talk. Why? Why does that default to a police officer? Because there's no, I just told you, there's no mental health hospitals left. There's nothing like that. There is nothing out there for these people on a large scale level to go, hey, let's take them there and get them help. It goes to us. We're the ones who get called. And so we're like, hey, we need to stop that. We don't like that at all. You know, sadly enough, many of those contacts across the nation end in deadly force. And so we're like, that's the last thing we want to happen. And so that was the kind of the goal of CIT, was to go out and contact these people where they were, make sure they were getting their medication, make sure they had a ride to their appointment. You know, go out, hey, Bob, did you go to Grand Lakes today? No, I didn't go. Well, hey, let me get you up there. You know, let me call your counselor and stuff. And so they developed great relationships with Grand Mental Health and with these folks living out on the streets, and tried to help them. And through that, they came back to me and they're like, hey, man, you know, there's a bunch of people in town do this stuff. You know, there's all these places, all these people that want to help. And so we said, well, let's get them together. Now, eventually, OSU PD had to pull their officer back because they ran out of manpower. So I had one guy left. He ended up not being a great fit on his own. He moved on, and I got a new guy in there now, started about 1.5 years ago. His name's Chris Houston, Officer Chris Houston. He's been with the police department for, I don't know, 20 years, something like that. He was with Perry PD before that. And he has an uncanny ability to be able to go out and connect with people at any station of life, anywhere. I don't care if he's talking to the president or a guy living under a bridge. He can talk to him. And he goes out, excuse me, he goes out and he builds relationships with these folks. And about 2 years ago, I started a team called the Community Action Resource Team. And I said, Chris, tell me who all these people are that can help. And so we started brainstorming who can come to the table and provide services that we can pull together. And so Our Daily Bread, Mission of Hope, Stillwater Medical Center, the District Attorney's Office, Youth Services, Juvenile Services, Workforce. I can't even remember who else there. You remember who else there, Rachel? I don't know. Grand Mental Health, Wings of Hope is there. We have this large group. We meet once a month and we staff things. We'll talk about individuals. Hey, I got so-and-so that keeps coming up there and doing this. Okay, well, this is what they need. Or, hey, Chris, can you come over here and deal with this guy, or can I call you whenever? But let me give you a good, for instance. What kind of problems do they solve? The hospital's like, well, we have them come in for treatment all the time. And we treat them, we get them ready, and we discharge them, and we're sending them back out there. Well, if you're going to get healthy, you got to have good food, right? You got to have, you got to at least have some good food to eat. And like, we don't have food for them. And Rachel's sitting across the table go, hey, I got food. what do you want? You want food bags? And, they go up there and that's just a small example of when you pull those resources together, what that does and what it brings in. And we get those people there, and we have solved, the district attorney. We have some people in town that unfortunately, their mental health episodes, they don't qualify them to be taken for emergency treatment, but it does require us to have to intervene with them all the time. They're like, you know what? We can put them in the jail, Grand Mental Health, come to our jail. They get in the jail, and they're like, we'll give them all the services we want. So we started doing that, and I think it's been a great success, and I think we're seeing, I always tell them my goal is to just do away with law enforcement response to people in mental health crisis. That's what I want to see happen. To that end, we're working with Grand Mental Health right now. Representative Ransom was at a meeting with us last week where we're trying to do a community outreach team. They've done it in Tulsa. It's called Streets to Home Coalition. And they're dealing with people that are in addiction crisis. And they've got a team that's going to come in, and they go out and they build relationships with those folks, keep going back, take them some food, take them some water. Here you go. Hey, I got a plan. I got a place that can probably help you with your addiction. And over a course of time, they go out 10, 12 times meeting with these people. And finally, one day that guy will go, or that girl will go, okay, let me go. And they'll take them somewhere and get them recovery, get them in an addiction recovery program. So I know that was a ton of information, a lot of numbers and things like that real quickly, but I wanted to put that out there and just kind of give you an overview of what the reality of our homeless is in Stillwater. And so I know we are out of time, I think, and so I'll be happy to stay around and answer any questions you have.
Let's do 2 quick questions.
The people, individuals that are standing on the street corners saying, these individuals standing on the street corners saying, I'm homeless, anything will help. Are they going to take those funds and go buy drugs with them?
Absolutely. Absolutely.
So
the people that I know in town that do that, one of them's not homeless.
even the ones where you have the husband sitting over here and
They're not
the
homeless.
wife and the young child.
They're not homeless.
They're going to go.
They have a home. They have a minivan parked over there in the Homeland parking lot that they're going to go get in and drive to their house. I know them well. The guy that sits at Chick-fil-A all the time, he has a home. He has a house at 810 South Jordan.
Well, quick
That's
question.
the truth.
Quick question here. A month or so ago, my wife and I thought, well, let's just go out and take some lunch bags, sandwich, apple, whatever, chips, and water. And several of those people, I think a half a dozen of them, the guy that was at Red Lobster and a guy on the bridge too. And
He's a veteran, yeah.
He's a veteran, yeah. And so anyway, I got the impression that looking at some of them, food wasn't really an issue for them, quite frankly. So, but I didn't want to give them money, just like we said, because a lot of those people are just going to go buy booze or buy whatever they're addicted to. They're going to buy fentanyl with it. So
Absolutely.
I did thought, well, I'm not sure this is meeting what we really need to try to do here, but or not.
So they do need food. Okay, I'm not going to sit here and say they don't. They do need food. Rachel's team can only do so much, and these folks have to eat every day. And if we're not giving them food, they're going to go steal it from Walmart. I mean, they are going to go steal it. But they do need food. Now, I'm not telling anybody not to give them food. Oh, yeah. Oh, yeah. Well, and they all have a phone, too, if you don't know that. That's why they're always at Walmart. It's not just to steal. Walmart has free Wi-Fi. And so they can use their phone, and they can charge their phone there. So that's another thing.
All right, I'm going to steal the last question.
Yes, sir.
Of the 20 or so people here, have they been here long term, or does that population turn over?
So there is a core group of them that stay here long term. The ones that you see turnover, now we have had kind of a weird phenomenon this past year. We've had 2 guys move here from Wichita. They didn't move here, they were passing through, and they found it so nice in Stillwater they decided to stay because everybody gives them food, and the little college girls are like, oh, here, and they give them money. And so they decided to stay, and we've had a couple like that, 2 from Wichita, 1 from Colorado. We've offered to take them back. They don't want to go. But in all transparency, we do that. If somebody's here and they're like, oh, I'm trying to get to Salisaw because I got an uncle that lives there. Well, if they've got a support system somewhere that can help them, my CIT officer is going to load them up and say, let's go. He's going to go buy them a Happy Meal and take them to Salisaw. And that's what we're going to do. Out of his own pocket, by the way, he does that. But yeah, we want to get people to a support system. So,
Well, Captain Stevens, we appreciate your work here, and we recognize literacy. So we'll be donating a book to the library in your name. So thank you very
Thanks,
much for your time.
Appreciate it.